Welcome, Gideon. Welcome, Grace. So I'd like to ask you both if you could describe, first of all, for the attendees, what is glucose monitoring? So, Grace, I think I'd like to ask you that first of all.
Thank you, Joan. So I'd like to say that glucose monitoring, it's what I would call a simple finger prick test using a glucose meter, a test strip, and also a small sample of blood that can be taken from the finger and used to measure the glucose level for the patient. That's one way of doing it. And the other way, which I know that Gideon will explain a bit more further, is using the flash glucose monitoring techniques and also continuous blood glucose monitoring using a sensor, an app, and also a reader.
Fantastic. And Gideon, would you say a few more words about glucose monitoring from your perspective?
I think what my colleague, I think Grace said is right. But if you go in terms of historically, if you look at the evolution of technology in terms of glucose monitoring, in the 50s, we had urine tests for glucose. Then the 60s up to the 70s, we got the so-called self-monitoring of blood glucose using finger pricks. Then with advance in technology in the 80s and 90s, we've got the so-called continuous glucose monitoring. And therefore, in terms of supporting these patients, I think with advance in technology, patients are getting better care. And that is why we're here to discuss about the evolution of glucose monitoring from the 50s up to now. And we are lucky that there's advance in technology, and this technology is here to support our patients. So our patient they have to be provided with the best care possible, including the use of technology, and that includes using continuous glucose monitoring to monitor their sugar levels.
And you both brilliantly described what we would call self-monitoring of blood glucose. Sometimes we call it home monitoring of blood glucose. So either using a glucometer, where you use the finger prick, and that's the capillary blood, or the continuous glucose monitoring, which I believe is looking at the interstitial level of glucose level of glucose in the interstitial fluid. And then some people, I find, and I'm sure this is the case for the two of you as well, confuse that with the monitoring that we as healthcare professionals do, which is the venous blood, and then we would look at things like the HbA1c. And so the HbA1c, just to clarify for those who aren't clear about it, is that longer term test of your blood glucose looking back over the preceding 2 to 3 months, whereas these methods are much more immediate methods, so the finger prick testing or the continuous glucose monitoring. So thanks so much. So why would you say it's important? What Gideon, why do you think you brilliantly described that historical trend. You've said that it provides that better information for the person who's living with diabetes. Why is that important?
I think that's a very good question in terms of why is it important to make sure that we monitor the glucose level, either using technology or self-monitoring of blood glucose. It's simply because people with either type 1 or type 2 diabetes, they have to have a better diabetes control to prevent the so-called microvascular complication and macrovascular complications, because we can get short-term complication if you've got very high sugar levels. For those who are type 1 diabetes, they can be unwell coming with the so-called diabetes ketoacidosis. For those with type 2, they can come with high sugar levels, the so-called hyposmolar hyperglycemic state. But also, most importantly, both types of diabetes, they can present with severe hypoglycemia causing complications. Those are acute complications or short-term complications. But for the long term, it's about complication to the eyes, causing retinopathy, or kidney problem, causing nephropathy. But also, we know that the commonest cause of somebody having amputation or feet ulcers is diabetes. So we want to prevent those both acute and a chronic complication of diabetes. And therefore, by having a proper glucose monitoring, whether it's self-monitoring blood glucose or using technology such as continuous glucose monitoring, we want to get better diabetes control and therefore reduce complications.
Thanks very much, Gideon. And Gideon, you had previously said, and I'll come to Grace to maybe expand on this, about for the person themselves in terms of person-centered care. Grace, why would you say that it's important to know what your blood glucose levels are? Gideon's, really outlined for us short-term and long-term complications that are possible and how you can use that as a tool to prevent those high or low blood glucose levels. What would you say for the person themselves?
Yeah, I totally agree with what Gideon said. I think it's really important to help the patient engage in their own personal care. And it also helps them to identify where their blood glucose levels are going low as in terms of hypoglycemia and going high in terms of hyperglycemia. And we know that this can actually cause them to, end up in hospital, which we don't want our patients to end up in hospital for both hypoglycemia and hyperglycemia, DKA, and so on. So I think it's really important that the patients engage so they understand their own diabetes. And we know that, for example, their diet will impact their diabetes, their physical activity will impact their diabetes, and so will the medication. So it helps them to understand what we're trying to do to set goals that are really pertinent to them as an individual, to manage their diabetes and be in control of their diabetes.
Yeah, and I think, in consultations that I've had with people living with diabetes, it's very empowering to know to know how physical activity might impact your blood glucose levels, to know how particular foods might impact your blood glucose levels. And so it's empowering to the person themselves to know what's going on, because otherwise, how would you know? Because I think there is a slight misconception that you can know if your blood glucose levels, let's say, for example, are high just by how you feel. What would you, the two of you, so I'm going to go to Gideon first. What would you say if somebody says, I know when my blood glucose is high, I don't need to monitor?
So I think that's a very good question. So yes, sometimes patients, they know their body better than us as healthcare professionals. But what I can say is that they might be feeling well while their glucose levels may be higher, not very high to be very unwell. For long term, it's going to lead into complications. So I tend to see some of the patients coming to my clinic saying that, okay, when my sugar level is 15, I feel better. You give me the new medication. When it's about 10, I get shakes and so on. So I tell them that maybe you have been running very high sugar level for a long time. Your body is used to that high sugar levels. You feel better at that time. But long term is not a good thing. So we have to try and, by monitoring, we will try and bring the sugar level to acceptable range, normal range, but the body will take time to get used to the normal range. So you might be feeling better, but your sugar level is high, and long term, you're going to have the complication which I've just told you, namely nephropathy, retinopathy, peripheral neuropathy. And that's how I put to the patient that we're going to support you. Keep measuring, show us the readings. We can provide you with the technology. By knowing what you are reading, we're going to support you in terms of either up titrating your oral hypoglycemics or up titrating your insulin to come within a target range, within range which is acceptable for both type 1 and type 2 diabetes.
Thanks, Gideon. And Grace, did you have anything to add to that?
Yes, I think that it also helps us to work with the patient. I mean, to actually, set the goals, the right goals for them as an individual. It helps us to plan their treatment, helps us to support them in terms of frequency of blood glucose monitoring and what to do with those numbers when they get them. When they feel okay, it may be high, as Gideon quite rightly said, but equally, if it's low, they may not have any awareness of the low blood glucose, and this could be quite detrimental. And by monitoring, it gives us a picture of what is actually happening in their body. And sometimes they may feel okay, but they may not be okay. Either way, either low or high.
And I think, it's such an important tool. And I'm going to liken it to something like a speedometer. So you could be driving a car, and if you didn't have a speedometer in there, how would you know the speed that you're going at? You might be going too fast, you might be going too slow. But when you have that tool that shows you where you're at, it empowers you and enables you then to take appropriate action.